Okay. One of the things that I've I've defined it as a pyramid of care. Um, we're not told in the beginning we're sent to physical therapy, maybe occupational therapy. I didn't find out I needed speech therapy until 7 years later. That kind of thing. Do you feel like there's a better direction coming from uh, the medical professions coming together to coordinate better? I mean, is you have to be captain of your own team in my case. So I mean, do you find that it's getting better, or is it still a little lagging?
So I actually think so. I've had really positive experience recently in terms of really working together as a team, all different disciplines and clinicians really coming together to talk about a particular client, survivor, and thinking about what we can do to help. So, for example, let's say physiotherapy, it might be that they're really struggling to have someone engage in that, and then you could think, okay, why might that be? Is there any potential anxiety when walking again? Because if you think about it, walking practice is such a vulnerable thing for them. So then how can we then maybe do some joint sessions together with the physio and psychology and working together jointly to potentially overcome that anxiety? um, or potentially even like motivation to get back out of bed again. That's a quite a big barrier in rehab. So, kind of coming together and thinking about what reasons might this be? Can we involve psychology and having that kind of education that starts on mental health? Can that
Okay.
be useful? And often this is something that's happening a lot more now, which is good. It's moving in the right direction.
Is that moving in a right direction? You're in Great Britain, so of course you have the NHS. Is it
Yes.
moving that way because of the NHS, or is it because of the practitioners?
So I would say that because the conversations of mental health is increasing and it's becoming more of an open conversation, the guidelines within the NHS and potentially other healthcare organisations, they are becoming more aware of mental health and how can we implement that into stroke recovery and rehabilitation as well.